just to give a very brief introduction about Dr. Julka to anyone who doesn't know about him. Dr. Julka, of course, is the principal director of the Oncology Center of Max at Lajpat Nagar. He's been dean also of the premier All India Institutes of Medical Science, known as, of course, AIIMS. He has received multiple awards, including the Padma Shri Award, and we are very grateful, sir, that you're here. Sir, here. Thank you so much, sir. It's Breast Cancer Awareness Month. Very significant. We all have heard of the word breast cancer. We all know that we need to self-examine. There is a basic information which we all have, sir. But what more do we need to know about breast cancer? Why is this month so important? Why is this conversation so important, first of all?
Yes, this is very important. I hope you can hear at the back. This is very important because, people come to us in advanced stages. You won't believe it that we get patients who have, breast lumps which are, ulcerated, bleeding, discharge, everything. At that stage, even a few doctors I have seen, they say, we don't have time. One of the doctors, I won't name the doctor, she said, I have to do cesarean, I have to do that, I have to do that. I said, you have a lump in the breast, and I palpated myself and I told her, get a biopsy done. It was 1 centimeter lump and she did not get the biopsy done. Going in for homeopathy, going in for Ayurvedic, please don't misunderstand me. Ayurvedic and homeopathy have no authorized treatment for breast cancer. Let me tell you openly. I'm not against it, but there is no clinical trial, there is no authentic trials on that.
Right.
Ayurvedic and that. And ultimately she collapsed. Now, what lesson do we learn from this? If the doctors don't listen, the others should listen. I always say, now American Society of Clinical Oncology, I am a member of, emeritus member of ASCO, American Society of Clinical Oncology, because I've been going there for last 10 years, 15 years, ASCO, that is called ASCO. So ASCO recommendations are different. For Americans, there are different recommendations. They don't recommend the self-examination of breast. And I always say, because recently I saw 20-year-old girl, 19-year-old girl having a breast lump. Formally, once we did a biopsy, it came out to be invasive duct carcinoma. Now, what do we do about that? So I always say, innovate the Indian scenario. And Indian scenario says 20 years to 30 years, do breast self-examination. With the right hand, do the left breast examination, left hand do the right breast examination, and see if there is a lump in the breast. It may be a painless lump. So that doctor whom I was talking, she said, there's no pain. Why should I go get a biopsy done? I said, no, it is a painless lump. And once pain is there, then that means there is infection or there is some inflammation. So don't worry about that. Painless lump is diagnostic of cancer. Not always, but mostly. So you must get yourself checked up, get a biopsy done, get a mammogram done. Now again, on mammograms, people go and get mammograms done and come to us with the mammogram. Now this is not the way. I always say 20 to 30 years breast self-examination, 30 to 40 years at that age, get a ultrasound of the breast, or if you are suspicious, get MRI. Don't get mammogram. After the age of 40, if you have a family history of breast cancer, go in for mammogram, and nowadays we do MR mammogram, MRI plus mammogram, which gives us better results. And we have now tomosynthesis, which I got in AIMS. So tomosynthesis is available in AIMS, and that is, we do a CT scan, and 3-dimensional we can pick up lump in the breast. So lump in the breast or lump in the axilla, armpit, or in the neck, or nipple discharge, that could be cancerous, but you must get it checked up from your doctor.
Right. And so, you've elaborated it. Of course, you've spoken about the various stages, how one should examine oneself. But help us also understand why examine. I'm going to take forward, the anecdote which you just said about a doctor who didn't want to take it very seriously. Unfortunately, of course, it didn't turn out very well for her. Help us understand today, why do we need early diagnosis? How does it help you as a specialist, sir?
Yes. Now, early diagnosis, I always say, is the hallmark to cure. Why it is hallmark to cure? Because if you diagnose a 1 centimeter lump, you just remove the lump, and if it is hormone positive, we have now genetic test available like Oncotype DX, or we have Can Assist, the Indian test, which is cheaper, and we can, from that test, we can find out if she has a low risk of recurrence or high risk of recurrence.
Right.
So that means you remove the lump, nothing else to do, and get radiation done, finished. No chemotherapy, nothing, if it is hormone receptor positive. ER/PR, estrogen receptor and progesterone receptor. We call it hormone receptor positive, and if on your these genetic assays it shows low risk of recurrence, no need of chemotherapy. So you avoid chemotherapy, avoid falling of hair, avoid your discomfort, and then you are through it. 100%, more than 90% curable.
You say 100% more than 90% curable, and I want to emphasize on it, sir, because cancer is a word which rightly so brings dejection and fear in our minds. Many persons, just about anyone, if unfortunately anyone's detected with breast cancer, everyone thinks that's the end of the world. Clearly not, isn't it?
Actually, the word cancer means death warrant. That is what people think. It is not a death warrant. Let me tell you openly. Cancer is curable. Not only now, it was curable earlier also. I must have treated more than 20,000, when I counted breast cancers in the last 45 years, and in AIMS, and now in MAX also I am doing. So what I am saying, that even those days, because those days everybody got mastectomy. I am tracing my journey of breast cancer for the last 45 years. So earlier people used to get 80s, I am talking of early 80s, 70s. And people used to get mastectomy done, all of them. All of them had radiation therapy. All of them had chemotherapy, CMF or CEF, that acronym, So that is not the situation now. Now we have moved forwards. We know the hormone receptor status, we know HER2 gene status, and we do genomic profile also. Nowadays the future of oncology is in molecular profiling. We always say that you see your Janampatri, astrology, and we will give you molecular Janampatri. So molecular horoscope will give you, and molecular horoscope tells us this gene is defective, attack it.
Yeah.
So then if one gene, suppose BRCA1 is defective, like in Angelina Jolie case, earlier when I was in AIMS, she had mailed me that she had both breasts removed. Now what should she do? I told her, remove both of your ovaries, and not only ovaries, tubes also. Ovaries and tubes, salpingo-oophorectomy, bilateral. Why? Because it can come in the tubes or ovaries. So
yeah.
that is very important. And in hormone receptor positive cases, which are advanced breast cancer, preventively, prophylactically we call it, we remove the ovaries and the tubes if the patient is not keen on further having children. And fertility preservation is also very important in breast cancer, because people are coming at younger women are coming, and we always say that you get your eggs cryopreserved. Cryopreserved means preservation of your eggs, and in males preservation of sperms. So all this can be done now and can be used later on, and fertility preservation is very, very important nowadays once you are detected with breast cancer.
Sir, you're literally anticipating and answering my next question also. But I wanted to ask you, I mean, you're an institution in yourself. You talk to us about your 45 years of journey. In that, you also took us through how the treatment of breast cancer has changed over the years. If we speak specifically of a change, because we're all laymen here, in layman's terms, what has changed when it comes to treatment, when it comes to, surgeries? What really is the advancement, if we speak of as of now, sir?
Yes, the advancements are, earlier I told you, all mastectomies were done, all the complete breast was removed. Nowadays we remove the lump only, along with 1 centimeter of the normal tissue. That means the margins are negative and we remove the lump, and in the axilla we do sentinel node biopsy. Sentinel node means the node which is, the Darban which sentry which stands outside. From there it has come sentinel node. First level nodes are here in the axilla, armpit. So we remove those nodes in the OT, operation theatre. We see those nodes. If they are positive, we remove all the nodes. If they are not positive, we leave it as it is. So there is no lymphedema, swelling of the arm. So we can save that. So this is the advancement of surgery, and that is why we insist on early diagnosis. Early diagnosis, if you diagnose 1 centimeter lump, 2 centimeter lump, we can remove the lump, and we also see the breast to tumor ratio. If the breast is very small and the lump is 3 centimeters, if you remove the lump, hardly you see any breast tissue. So we fill up that gap with some other muscle. That is also done. So this is a new advancement.
Sir, since we're speaking of advancement, and I don't want to have a conversation because the conversation is happening in Delhi. I don't want it to sound like that we're sitting in an ivory tower talking about this advanced surgery. There is Ayushman Bharat also, which gives a 5 lakh insurance cover. There are a lot of rural women also who are suffering from breast cancer. What about them, sir? How expensive is this treatment? Can they not afford it? At least today's time and age, I think they can.
I always say that Ayushman Bharat scheme, we should make use of this, because all the patients who are coming to us cannot afford the treatment. Because nowadays the treatment is not only surgery, radiation, chemotherapy, hormone therapy, it is targeted therapy also. Once a woman, and it is just a coincidence that what I find in the poor ladies, they get HER positive. So, and HER positive means that treatment is expensive. Herceptin we used to call it. Now trastuzumab, the drug which we give, is expensive drug which everybody cannot afford. And nowadays we add another drug called pertuzumab. So they are expensive. So that is why I always tell their relatives or everybody to get some insurance done, so that at least Ayushman Bharat gives you 5 lakhs. In 5 lakhs you can get your major treatment done. Major treatment means if you're advanced case,
yes,
you can get your chemo done, you can get your hormone therapy done, you can get your surgery done.
And since we are speaking of inclusivity, we've spoken of course, the treatment including even urban women. it's a platform for women. We're speaking only of women. Breast cancer, people relate to women. But nowadays, there is breast cancer in men also, isn't it, sir?
Yes, we are treating quite a few male breast cancers also. It is 1% of female breast cancers. 1%. And males get breast cancer by genetic defects. You know, there are various syndromes coming up. So I don't want to highlight into all that. But again, it is the hormonal defect, and they may also have the genetic, predisposition. So that is why we always say that even males should check for their lump in the breast. Males might also get, or nipple discharge in the males. So males are rare breast cancers. It is 1% of all female breast cancers. Treatment is same as a female breast cancer.
So rare, but it does happen. Before I throw it open to the audience for a question or two, one or two more questions, sir. One about the recovery period. Once, someone's chemo is done, surgery is done, that doesn't mean that you forget all about breast cancer, isn't it? What is the recovery period? What is, how long is it? What are the precautions and cautions which one needs to take post, their surgery or post the treatment for breast cancer, sir?
Yes. Now, this is a very important question. I always say more important than treatment is follow-up. Follow-up must be done, because at follow-up we can find out. We call the patients at frequent intervals. First year we call it every 3 months. Second year maybe 3 to 6 months. Then later on yearly we call them for all. And mammogram and DEXA scan. DEXA is a bone density scan. We get it done yearly. And the other scans, or ultrasound abdomen and all other scans, chest x-ray, we get it done every 6 months. So we have made a protocol for follow-up. So follow-up is very important, and in follow-up we can pick up small tumors if they are having recurrence. And smaller tumors having recurrence can be cured. Not only controlled but cured. So we want cures in breast cancer, and the cure rate has gone up very high. Even though the incidence of breast cancer is increasing, over 2 lakh cases of breast cancer, but cure rate has gone up. The mortality has gone down. You must remember this. So why have morbidity unnecessary when you can get yourself cured in early stages?
But why the increase, sir? There are many reasons to that also, which if you'd like to underline them,
Yeah.
because we're seeing
Now-
a bigger increase in urban areas.
Yes. Now the reasons for increase are not only your genetic predisposition. If you have a first degree relative, like Masi, or you have nearest of your relation from father's side or from mother's side, if you have any relations having breast cancer, not only breast, ovary, prostate in your male relatives, all these are BRCA positive, and pancreas. All these cancers are BRCA positive cancers. They may be BRCA positive, they may be BRCA negative also. But you have possibility, higher chances of getting these cancers in individuals who are, relatives of yours having all these cancers. Ovarian cancer is another one. One patient is coming to us, mother had ovarian, father had prostate, and the daughter has breast. So all these cancers are gene related cancers. So one of the reasons of increase is genetic predisposition in the families. This is less than 10% of the cases, but majority are lifestyle related. Lifestyle, I mean sedentary habits, smoking, alcohol, all these, I'm not telling just because of alcohol being present anywhere, but I'm just saying that these also increase the risk of breast cancer. the main is lifestyle. It is, we always call it a lifestyle cancer. So smoking and alcohol also predisposed to it, and sedentary lifestyle. If you don't do exercise, now somebody asked me how much exercise is important. It is 40 minutes is advisable from the American Society. In our situation, I say at least half an hour you should do exercise. Walking is, brisk walking is good enough. So you need not go to the gym and or do
Right. So
gymming.
genetic predisposition and of course lifestyle. So last question, any message you'd like to give? Because the idea was to inspire women, to give, a message of optimism and positivity. Last word to you, sir.
No, I would like to say in the end that breast cancer is curable if detected early. Number one, early detection is the hallmark to cure. Why I again and again emphasize? Because if you detect them early, you palpate yourself, you feel yourself, any lump in the breast, don't ignore it. Go to your doctor. You can go to any doctor, like a physician or a surgeon, or you can go to your gynecologist even. Today I was talking to gynecologist before coming here. I said, you must know about breast cancer and you must see breast also. Once you're doing gynae examination, you must see breast also. Because in Europe, in Germany, the breast cancer is being treated by gynecologists, not by oncologists. So this is a very important thing. All gynecologists must palpate the breast and must see if there is a lump in the breast or if there is a discharge from the nipple. They must get checked up done, because it is not only cancer, it is finding out tuberculosis of the breast also, because some discharges, nipple discharges, may come out to be tubercular and we are mistaking them for cancer. So why have the tensions, anxiety with you? Early detection, go to your doctor early. If you palpate a lump or if you see a lump or nipple discharge, go to your doctor, respective doctors, gynecologists or surgeons, and get yourself checked up. You must get yourself checked up and don't ignore it. That today I have got this function, tomorrow I'll go. Tomorrow another function, I'll go day after. I have given you example of that lady, and I was so angry. It was a 7 millimeter, 1 centimeter lump, which I detected just on palpation. In US, I was working in MD Anderson, Houston, Texas. So there, they used to cut jokes, and they used to say that you will detect some lump or the other. I said, no, it's not that. It is the experience which counts. And because I used to palpate all myself, I never allowed residents also, we teach them and we palpate ourselves. And I used to find out a lump in the axilla, which they missed on some occasions. So that is what I am saying. Proper thorough examination is a must. Whenever you see or you detect any changes in your breast size,
Right.
or breast discharge, nipple discharge, or breast lump,
Right.
any changes.
It's been a very riveting session, so very informative, and thank you for joining us. I hope it's been very informative for our viewers and anyone, of course, who's watching it as well. Before we close, if there is any question from the audiences, if anyone would like to ask, we can take a question or two.
Mike,
So-
Should women suffering from PCOS, PCOD or hormonal imbalance, should they be more cautious about it? And my second question is, other than lumps and nipple discharge, can swelling of breasts be the early sign of breast cancer?
yes, this is a very good question. PCOD, PCOS, all these gynecologist takes care, because generally you go to gynecologist and they take care of hormonal imbalance, because hormonal imbalance should be taken care of if there is any. And secondly, breast, why I was talking about the size of the breast, because every day while taking bath you see if there is a sudden increase in the size of one breast comparative to the other, then you must get yourself checked up. Not that it may be cancerous, it may not be cancerous, it may be just like that, fatty tissue.
Okay. Any other question? Last question. We don't have enough time. Okay. One more question. That's it. Go ahead.
Okay. So basically, the working women these days have a lot of stress to deal with, and it is being told that stress is the biggest reason of breast cancer. So what are the major changes that one sees in oneself, that noticing which one approaches a doctor, gynecologist or whatever?
This again is a good question. I didn't touch upon it because of, I think, the time was like
Please
that.
go ahead, sir.
But I said the stress leads to obesity. And obesity is another cause of breast cancer. Why? Because more male hormones in the thigh region, or obesity, more male hormones are converted to female hormones, that is estrogens. And these estrogens are the culprit for breast cancer. So that is why these stress related cancers, what I am talking is, because they are leading to more obesity. Generally with stress one tends to eat more, and watching the TV and keep on eating. So they get obese. That should not be done.
Right.
And exercise is a must.
Right. So it's going to be a combination of lifestyle changes, and of course keep taking care of your breast, looking for a lump, looking for those signs, and early diagnosis. End of the day, that's something which you have emphasized on and reiterated throughout this conversation, sir. Once again, I thank you. A loud clap for Dr. Julka for talking to us, taking all the time to speak to us on this extremely pertinent issue, sir. Thank you so much.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.